Imagine being told for years that pain is normal, only to find out that it has a name. Today, we are putting a name, a face, and the facts of endometriosis. Hello, everyone. I am Dr. Nilanjana Chatterjee, consultant gynecologist at Bhagirathi, Neotia, Newtown, and we are honored to welcome Dr. Shankar Mahapatra. Dr. Shankar Mahapatra is a consultant gynecologist at Bhagirathi, Neotia, Newtown with experience over 30 years in women's health and a special focus in endometriosis, surgery and care. Welcome, sir. Today we are talking about a condition that affects millions of women, yet often misunderstood, and the diagnosis is delayed. Sir, if you can please explain what is endometriosis in simple terms.
Yes, I'll show you this model. You can see this is the this is called endometrium. This is the inside layer of the uterus. If this endometrium is placed outside the uterus, that is called endometriosis. It may be happen in the ovaries, it may occur in the fallopian tube, it may occur in the pelvic peritoneum or rectum, anywhere outside the uterus, that is called endometriosis. And due to this presence of endometrium in different parts of the body, there is some inflammation, there is some pain, or there is some scar tissue formation inside the pelvic cavity that will cause severe pain. That is called endometriosis. In simple terms, endometrium outside the uterus is called endometriosis.
Thank you, sir, for the wonderful explanation. Sir, we often find that people who are suffering from endometriosis are seeking advice quite late. Is there any reason behind this?
Yes, definitely, because endometriosis is an enigmatic disease. Actually, the symptoms, we cannot diagnose the symptoms properly, because in most of the cases there is no non-invasive test to diagnose the endometriosis. In sometimes if there is normal pain but there is endometriosis, sometimes we do a sonography or MRI scan but there is no lesions of endometriosis, there is severe pain is there. So it is very difficult to diagnose. There is no standard tests, no biochemical markers to diagnose the disease. Like diabetes, we can easily diagnose the diabetes by the high blood sugar, but in this endometriosis there is nothing is there, so it is late. So we have seen in our cases, at least from the beginning of the pain, it will take 7 to 10 years to diagnose the disease. And sometimes the patient goes to the general physician. There they actually diagnose the disease. They give some analgesic medicine, and patient becomes relieved. Then they forget about the disease. So, and sometimes actually in our country, women are teachers from the childhood that period pain is normal. So you have to tolerate it. For these are the reasons you have to diagnosis delayed. But sometimes we can advise these patients to do a laparoscopy. But patients are not ready to do a laparoscopic surgery in the young age, because if they are unmarried, they don't want, because there is a social stigma. If you do a surgery for a young woman, there is some problem during the time of marriage, so they will avoid it. So these are the causes where there is some delay of 7 to 10 years after the diagnosis of the starting of the disease.
Sir, we have heard of the term complex endometriosis. If you can explain what is complex endometriosis.
Complex endometriosis means deep endometriotic tissue when that invades the peritoneum, that is called complex endometriosis. Sometimes there is a big ovarian cyst that develops, that is called chocolate cyst, that is called also complex. In simple terms, when the endometriosis goes outside the pelvis, that is called complex. It may involve the rectum, or it may involve the urinary bladder, or may involve the ureter, affecting the kidneys. Sometimes it may go to the diaphragm, sometimes it go to the liver, in the heart, in the lungs, in the nose, any time where it can go. So these are the cases of complex endometriosis. When it goes outside the pelvic cavity, and there is some adhesion, all uterus, ovaries and rectum or intestine, large are adherent with each other. That is called complex endometriosis. That may cause fertility in the later stage.
Sir, as we just discussed that there is a delay in the diagnosis of endometriosis, so if you can just tell us about the symptoms that can alert people about endometriosis.
Yes, every disease will give some amount of alert to the hints to us, because actually we are avoid all these things, because most important symptoms are there is severe pain during the time of menstruation that cannot relieved by the medicine. That is the first symptom. Second symptom is there is pain during intercourse, there is pain during passing of stool or passing of urine, there is sometimes backache, sometimes there is chronic fatigue after the menstruation, there is sometimes bloating sensation inside our abdomen, there is sometimes 2 to 3 hours after the marriage there is infertility problem. These are the main symptoms of endometriosis.
Sir, a major concern about a woman suffering from endometriosis is that whether she can conceive naturally because of this endometriosis. What is your opinion about it?
Yes, sometimes in cases, severe cases, sometimes they can achieve pregnancy naturally, but you have to struggle hard because in endometriosis, if there is severe endometriosis, there is tubal blockage may be present. Sometimes there will be adhesion between the organs, because, and sometimes there will be, I can explain you by this model. You can think this is the ovary, both side ovary. There is ovum actually develops in the ovary that will go inside the through the fallopian tube, and sometimes that will be blocked, that cannot enter inside the fallopian tube, and sometimes there is due to the endometriosis there is ovarian tissue is damaged, and there is less number of oocytes in the ovary, and there is egg quality also affected in this endometriosis, and sometimes there is some environmental problem in the inside the uterine cavity that will phagocytes the, actually they will engulf the ovums that will come out from the ovary. These are the main causes. Patient cannot become pregnant. Some action is required. We do the surgery for endometriosis. In that cases, we will actually tube-ovarian relationship becomes established. There will be proper ovulation will be there. Sometimes, if not, the patient becomes not pregnant naturally, they will, then will give the ovulation induction agent. Sometimes it will not work. Then ultimately, we will send the patient to in vitro fertilization or test tube baby.
So, what are the different methods of treatment for endometriosis?
You can ask him all endometriosis or any specific endometriosis.
Sir, for complex endometriosis?
Actually, there are many types of methods of treatment is there, medical treatment, surgical treatment. But I can tell you, guarantee you, in cases where difficult endometriosis or have more grading of endometriosis, surgery is the only option, because if you understand the endometriosis properly, endometriosis there is scar tissue inside the pelvis. If you don't remove the scar tissue, there will be no actually improvement of the symptoms. Only if you can medicine only can alleviate the some symptoms of they will decrease some pain, but the fertility will not improve. Ultimately, pain will not improve. So you have to do the surgery in case of difficult or higher grade of complex endometriosis. That is the only option for the endometriosis. If you don't do surgery, pain will persist, fertility problem will persist. So you have to do the surgery in the advanced stages of endometriosis.
Sir, often people ask that is there any complete cure to this endometriosis, or is there any chance of recurrence? What is your opinion?
There is no complete cure. That is not possible, because endometriosis, like diabetes, you can see, when you have diabetes, you have to take the medicine, and it will take the lifelong. You have to take insulin injection or diabetic. Like this endometriosis also. If you think the pathology of the endometriosis, we can only remove the macroscopic diseases by the surgery, but macroscopic diseases are already there, that will regrow. So we have to treat this in such a way. After the surgery, you give some medicine, some injections, that will not, recurrence will not occur, or recurrence will be less. But most of the cases we have seen, all literatures, 15 to 20% cases endometriosis recurs after surgery, and many expert hand we have seen that at least 5 to 6% cases will recur, and most of the cases in inexperienced hand 50 to 80% cases endometriosis will recur. So I can give you advice in these cases. First surgery is the best surgery, because so you have to choose your doctor, choose your endometriosis surgeon very properly. Otherwise, if a surgeon is experienced, does the surgery, then recurrence will be less. But if you done by a very inexperienced surgeon, recurrence will be very high and damage of the tissue will be very high. So this is the very important point. You have to choose your doctor very properly or specifically, so that your disease will be cured in the first chance only. Otherwise, we have to suffer, because many patients come to us with the 2 to 3 surgeries previously. After that, I did the surgery, but that was very difficult surgery in our from our side.
So that is a very important piece of information you have shared with us. Now, would you like to tell us about some diet or habit that lead to endometriosis?
And there is some nowadays there is many advertisements like this food you take, endometriosis will cure. That is not at all a issue. Some disease, it will reduce some symptoms, severity symptoms will decrease by taking diet. So we have to avoid some diets, like you have to avoid all type of inflammatory foods. Like I tell my patients, you avoid, no, don't take red meat, don't take alcohol, don't take caffeine like products, don't take sugary type of foods like cakes, pastry, all this type of foods. So and have to take proper sleep. So that is the actually lifestyle changes and the food habit. If you take properly, then symptoms will decrease, but disease will not cure. That is the only complementary.
Sir, please tell us about some lifestyle changes that can help us to manage the symptoms of endometriosis.
I only tell my patient, here reduce your anxiety, you do some type of meditation, so your anxiety will be, proper sleep is very important for her. Take proper plenty of water, and these are actually lifestyle changes. So a regular daily exercise, at least 30 minutes brisk work and regular workout, that will help definitely help us to cure some symptoms of endometriosis. And sometimes you have to socialize, you have some help group support, you have to take support from doctors, take support from your husband, you to take support from your relatives also. So there will be some reduction of the symptoms of your endometriosis.
So, what is your final message to a woman who is suffering silently?
Actually, endometriosis, period pain is not normal actually. We are thinking period pain is normal. Most of the women thinks that period pain is normal, but period pain is normal. Don't suffer silently. You know about the endometriosis properly. You have to know some facts. Endometriosis will recur. You have to tolerate, and you have to choose a very good endometriosis specialist, so that in first chance surgery will be best surgery. If you diagnose come to us in earlier stage, then we do the surgery or give the medicine, so the chance of your pain will decreases and chance of fertility will increase. So don't suffer silently, please come to us, we are always with you, we are trying to always ready to help you. So knowledge is power. You take knowledge of endometriosis and you take your own decision of your own life. So we are ready to help you.
Endometriosis is tough, but knowledge is power. If you are someone who is suffering from endometriosis or walking beside someone who is, then your pain is real, your voice matters, and please ask questions. Thank you, sir, for sharing your valuable knowledge with us. Thank you so much.